My name is Dr. Michael Awad. I am a second-generation OBGYN. My father delivered babies in this clinic for the last 40 years, and now I'm delivering babies of babies that he's delivered. I've seen the complexities of obesity really be a challenge as the years have gone on. We've seen the obesity rate skyrocket in maternity and motherhood, and it has posed a challenge for operating on these patients and providing them care in a safe and healthy way. So in managing atypical or abnormal vital signs, we have to make sure that we have the appropriate tools to manage them, and that's where traxi comes in. At baseline, a pregnancy complicated by obesity is a high-risk pregnancy. Having a retraction of a pannus out of your surgical field makes that much easier than having to traverse through 4 or 5 inches of subcutaneous fat.
We lift the pannus up with our hands and we're able to basically place it from the bottom to the top. Sometimes we have the surgical nurse help us with this, but a lot of times we can just do it, just us two.
Using traxi, it's very reproducible. Every single time you use it, it works the same way. And I have never had a case where the pannus was released back into the surgical field. So the reliability of this product is great. It's very, very easy to apply. It's very user-friendly. There are tabs to pull and it'll say pull tab 1, tab 2, and it walks you through it just directly on the product.
When I demonstrate this product to the physicians, the feedback that I typically get is that it's very intuitive, it's a quick, easy process to be able to place it on the patient and get moving right into starting the C-section.
So the alternatives are not great. The alternatives are to use more assistance or to use very old methods of taping the pannus. The tape doesn't hold, the tape releases intraoperatively, potentially contaminating the surgical field.
The first time I was using traxi, the patient had previously had another C-section where they'd used tape on her, and after the procedure she was ecstatic to say that she'd loved using the traxi product versus what they had used previously, the breathability aspect, all the benefits of it, and that's exactly the way that we want our patients to feel after they have their C-sections.
So during the surgery, the traxi, it lifts a huge weight off my shoulders because I know that that field is going to stay sterile. It's not going to retract the pannus. It's not going to fail on us. I know and I can be confident that it will work and do its job.
What I would tell my fellow physicians is make sure that you're being vocal with your purchasing manager and your hospital administration to make sure that you have the necessary tools to be able to treat your obese patients. Being able to be there for my patients and go along this journey with them and be able to help them get where they want to be safely is one of the best parts of my job.